The biggest change that I've seen in my professional career has been the incorporation of research and particularly clinical trials into the frontline treatment of children.
Traditionally, we've tended to have followed the adult trials because obviously there's more adults and therefore the clinical trials are much quicker to run. Now that we have all this molecular information on these diseases, we're now starting to formulate pediatric specific trials for these diseases.
Our fundamental understanding of how we categorise tumours is now in evolution, and that evolution is going to open up molecular targets which we will now use the new generation of treatments that will replace chemotherapy and radiation in the long run with these newer molecular targets as we can identify the specific targets in children.
Whilst we currently have these therapies that are successful, what we want to do is find new therapies that will be more specific against the tumour and with less side effects so that the children are cured and also cured with excellent quality of life.
We owe it to these children to get new therapies into clinical trials as quickly as possible. We need to open more trials for children, whether they be in targeted therapy or immunotherapy. And to do this, we need to operate differently and collaborate internationally.
It's the nature of Australia to be collaborative, and it has so many pockets of excellence that we would be remiss if Australia wasn't a part of it.
I do think that we can teach the world a thing or two about collaboration. I think that, you know, maybe it's probably a little bit of the Australian nature as well, that we're sort of quite open.
Brain cancer research needs to be borderless. In no segment is this more important than in paediatric. This is why collaboration is the cornerstone of Cure Brain Cancer's research strategy.